Air pollution is a major environmental health problem affecting people in low, middle and high-income countries. According to the World Health Organization, ambient or outdoor air pollution in both cities and rural areas was estimated to cause 4.2 million premature deaths worldwide per year in 2019. This mortality is due to exposure to fine particulate matter, which causes cardiovascular and respiratory disease and cancers. Respiratory illnesses in Delhi are surging, with a significant rise in the number of hospital admissions linked to toxic air and even deaths. Deaths due to respiratory diseases in the city have more than doubled in 18 years. In 2005, respiratory diseases accounted for 4.91% of all institutional deaths. By 2023, air pollution in Delhi contributed to nearly 9,000 deaths, with a 9.93% rise in fatalities linked to respiratory diseases like pneumonia, asthma, chronic obstructive pulmonary disease, commonly known as COPD, bronchitis, and other acute infections. Doctors warn that pollution is aggravating pre-existing conditions and triggering new health issues, especially in vulnerable groups like children, the elderly, and those with chronic illnesses. The surge in respiratory cases have strained hospitals, with many reporting a significant rise in admissions, particularly during winter months when pollution levels are at their highest.
The air quality is actually so bad that the effects start from your skin. So there is kind of itching, all kinds of skin problems are occurring, burning eyes, burning in the nose, congested sore throat, difficulty in breathing, even to normal people, worsening of the difficulty in breathing in those who are already known asthmatics, occurrence of breathing problems, worsening of pneumonias in people who have COPD and other problems, known increase in admissions because of pneumonias, because of heart attacks, because of brain attacks. So there is a long list of problems which we all have recorded to occur with a much higher frequency post these most polluted days compared to similar days in rest of the year.
Medical experts note that the situation is made worse by factors like antibiotic resistance and increased frequency of infections, which are both linked to prolonged exposure to toxic air. Clean air, which is a fundamental human right, is now taking a heavy toll on people's finances. Medical costs associated with respiratory issues, ranging from mild conditions like common cold and cough to more severe diseases like lung cancer, are staggering. On average, the cost of a doctor's visit for a routine cold or cough caused by air pollution can cost you somewhere between 500 rupees to 3,000 rupees, or between $6 to $35, excluding medication. For more serious conditions like asthma, COPD, or lung cancer, the daily medical expenses can be even more overwhelming. A lung transplant can cost you up to 2 crore rupees, or over $236,000. But how can one improve the situation? Many people opt for air purifiers for better air quality, but is it really effective? The cost of an air purifier in India can range from 5,000 rupees or $60 and can go up to $1,000. While air purifiers can certainly improve indoor air quality, this might not be a complete solution.
For a long time, we thought that air pollution perhaps causes only respiratory problems. Okay, if you're asthmatic, if you have COPD, you'll be affected. But now the new science has established very clearly that air pollution hits and affects each and every organ of our body. And the fact that the pollution levels are so high that only small incremental steps cannot help. You really need leapfrog solution. Purify the air, you need to shut down everything. You just have to confine the air. You can't open your windows, you cannot open your doors, and therefore you purify. But a longer use of that will also be unhealthy, because then you are losing access to oxygen. The CO2 levels are increasing inside.
Experts stress that long-term solutions to Delhi's pollution crisis must focus on broader measures. That includes regulations on industrial emissions, better waste management practices, improvements to public transportation systems to reduce vehicular emissions, one of which is Odd and Even scheme. The scheme came to light in Delhi in 2016, a copy of the plan instituted in the United States in 1979. This rule allows cars with only odd or only even number plates to ply on a particular day. To simplify, if your car carries an odd number registration plate, you will only be allowed to drive it on an odd day and vice versa for even days. But the result didn't help improve the overall air quality. Despite temporary measures, the pollution levels in Delhi are unlikely to improve unless long-term interventions are implemented. Without such action, respiratory diseases will continue to increase.